Morning everyone, and welcome to our 2024 product launch. I think over the years these virtual launches have proved to be a huge success, as today we have a record attendance and by looks of things the numbers are still climbing. Guys, we're really not going to take up too much of your time. We're going to run through the industry changes over the last year, which Tony's going to present on. That will then be followed by Brian, who's going to run through the operational and claims developments over the last year. I will then have the exciting part of going through premium increases and product enhancements. And that will then be followed by our guest speaker today, Andre Jacobs, who will chat to you guys about NHI and developments over the last year. So with that, once again, I thank you, and the team thanks you for attending this morning. And without further ado, I'm going to hand over to Tony to start off. Thank you.
Hi there, and thank you so much for making some time to allow us to share some updates and discuss our 2024 product offering. Most importantly, thank you for your support. It's really appreciated. It's always a challenge to schedule a product launch with all the health activities that come around at this time of the year. However, I must mention that the Rugby World Cup timing also played, shall we say, a minor part in our planning, with it running from the 8th of September to the 28th of October. The A and B pools look scary, and how a World Cup in France, of all places, can give England the favourable Pool D. The draw must have brought tears to French eyes, although England do have the mighty Japan to face. I can see James watching the time, and yet again denying me my moment in the sun with you all. We live in interesting times. The Turnberry model is one of a mutually rewarding partnership with our brokers to provide the best possible solutions for your clients. In a relationship, there will always be challenges, and the key is how we respond to these challenges. COVID seems a distant memory from the first lockdown in March 2020. COVID brought many challenges, and with challenges, opportunities follow. We are fortunate in the Turnberry team that we have an interesting blend of seasoned operational players together with some new age thinking that has brought about some useful collaborations to provide innovative solutions. This has led to a catalyst for change at both a process and system level that has enabled us to make significant performance improvements, particularly over the last 3 years. This is a journey and not a destination, with the rapidly changing environment we live in. Mentioning seasoned players, we have the second retirement of a team member coming up later this year. When we worked out the numbers the two ladies have worked with me, it totals a combined 70 years. No names, as I value my life too much to disclose a lady's age. 70 years, almost as long as my marriage seems at times, and I'm sure for Cheryl as well. I thanked you for trusting your clients with us earlier, and this last year has been a volatile one with the changes with some of the medical aid and gap players. We have a lot of brokers, friends who've been with us for many years, and a number of new friends who have trusted us with their valuable business. I hope that you're finding our service levels and commitment are providing you with assistance in growing your business. From an operational perspective, we are constantly looking at opportunities to strengthen our team through recruitment, training, and systems development. I've mentioned to you before that you can only provide the right level of service when your people, processes, and systems are all operating at the desired level. The key business areas of focus are, and will continue to be, our claims area, where we have shortened our claims processing times by enhancing our digital submission process, together with rationalizing our claims assessment processes, as we continue on our path of continuous improvement. Our latest system and process enhancements are currently being implemented. An interesting development following the impact of COVID on our claims processing has led to the move to a totally paperless claims environment that has negated our need to provide printing solutions to deal with. Previously, we were doing more than 500,000 copies within the claims area annually. Interesting that by linking the working from home to moving away from paper was the catalyst for the move. Prior to this, the paper was viewed as being an essential part of the process. Amazing what a little incentive can do to encourage change. New business, where we have enhanced our group take-on facility and further developed our digital pathway for you and your clients to submit business. We are seeing a steady increase in our digital new business. However, this will always be a journey that will increase as the business benefits are felt by all parties. It's a little like the online check-in process on airlines, where the critical mass follows the route of most benefit for minimal input. To go back to the impact of COVID, the lack of interaction with clients caused a slowdown in new business, and we were all looking as to how we can assist. An interesting development was with some of our broker partners was where they reviewed the penetration of GAP within their medical aid client base, seeing this as an opportunity in the quieter period. GAP cover is probably best sold at the same time as the medical aid sale. However, historically, this may have been difficult due to affordability or a lack of awareness of the value of the cover. We've been able to assist a number of our partners with digital campaigns to raise awareness of GAP cover, but also to provide a digital pathway for these clients to onboard themselves through a personalized broker portal. Where we have concerns from a brokerage on the security of their valuable client base, we can address this in consultation with the brokerage in a number of ways, from an outsourced solution to providing the material to a brokerage so that they can send out their own campaigns. Andre will be chatting to you a little later about NHI. NHI has continued to gain momentum over the last year and will continue to do so in the next 12 months, and Andre will expand on this. Practically, there are obviously several operational, governance and legal challenges ahead. The UK model is one that readily springs to mind. Interesting, it was launched in Manchester on the 5th of July 1948 at Park Hospital, now known as Trafford General Hospital. As a Liverpool supporter, it's good to see that there is some usefulness to the term Old Trafford. My apologies to my Manchester United friends. The UK model of having the NHS and private medical insurance operating together seems to be the most viable long-term solution. Recently, in May this year, the NHS has indicated that to assist in the backlog of a waiting list of 7.2 million patients requiring surgery, these patients would now be able to use the NHS app to check the waiting period for surgery in both the NHS and private sector and to choose the best solution. The welfare of a patient is key to any healthcare solution that is considered. We are continually keeping up to date with health trends, and our PR media coverage is obtaining great reach. Nearly 11.8 million people in the last financial year. These articles, opinion pieces, are picked up by great publications including Daily Maverick, News 24, Financial Mail, and various medical journals. We also use these for our social media posts and digital campaigns. As mentioned previously, if you need us to assist with the design of a digital campaign, please get in touch with your broker consultant. This slide reflects some of the articles that received great coverage and exposure for Turnberry Gap cover. Thank you once again for entrusting us with your business. We really appreciate it. Before James gives me yet another disciplinary, I'll hand over to Brian. Thank you.
Greetings to everyone, and thank you for your time today. It has been an eventful year, so I'll share some of the insights we have gained in the operations area. We have entered the new normal with claims submission, with so much value being offered and a greater awareness by policyholders of the true value that their policies offer. We have consistently experienced a higher rate of submission compared to previous years. This has not caught us by surprise. Through detailed analysis and forecasting models, we adopted the actuarial reserving methodology for IBNR 3 years ago, moving away from a linear industry-accepted percentage. What this means is that you can rest assured knowing that we have the ability to pay your clients' claims well into the future. A significant number to look at is the volume of claims we have paid last year equates to over 40% of our total policyholder base. The graph illustrated represents the monthly trends, indicating the percentage of clients who have their claims paid every month. Importantly, we are still paying complete claims within 2 days of receipt, a service level we are constantly refining through the implementation of automated processing. With a wide range of benefits offered to GAP clients, the greatest benefit still lies in covering the shortfall between medical aid rates and the specialist fees, followed by co-payments, sublimits, and non-DSP penalties. We have included an illustration based on our claims experience over the years of the percentage of a client's claim Turnberry is covering in proportion to their medical aid, with 2023 seeing GAP pay out 54% of the claim. In many cases, the percentage of the total claim paid by Turnberry is over 75%, as illustrated in the cases shown on your screen. The categories of claims paid has remained very consistent over the past 5 years. Notably, however, cancer has increased by just over 50% and now accounts for 1 out of every 8 claims submitted. Gastro, musculoskeletal, cancer and reproductive system claims remain the highest in terms of volume and associated shortfalls. Maternity has dropped off slightly from what we can see, mainly due to the increase in natural births as opposed to caesareans. Caesareans being more common during the COVID period due to the extended isolation requirements associated with opting for natural birth. Turnberry is here to support you and your clients for the long term. While regulation limits us to the overall annual limit, when looking at a client's life cycle, we have in many cases far exceeded that. The graph illustrated shows the total claims paid to individual clients over the past 5 years, with a significant number of them being over 200,000 Rand. All of the information presented is available for your individual brokerage, and we are able to customize any reporting requirements you may have, down to the most granular of level. So please reach out to myself or your broker consultant, and we would love to assist you with your business.
Thanks, Brian, for the updates on the operational and claims developments within Turnberry over the last year. And then also a big thank you to Tony for actually sticking to the time limit allocated for his part of the presentation, and also for not doing too many changes at the last minute. With that, I'm going to jump straight into the product developments and enhancements for 2024. The Premier option, the new Premier increase for 2024 is 588 Rand for under 65-year-olds and 845 for over 65s. Slight increase there in premium. You will also see that we've got a new benefit, which is the new individual rates on Premier, which is 433 Rand for individuals under 65 and 591 for over 65s. The overall annual limit has increased obviously in line with the demarcation regulations and will change again in April next year. Co-payment benefit on the Premier option is subject to the OAL. Our sub-limit benefit has increased from 38,000 to 41,000 for next year. Our non-DSP benefit has had a slight increase as well to 15,500. Our trauma recovery care benefit has also had a nice increase from 3,000 to 5,000, with a maximum of 10,000 per family per annum. Then our cancer benefits, which are obviously important benefits on the Premier option. Our innovative cancer drug benefit, which is a benefit that we introduced at the beginning of this year, we've increased that as well from a 10,000 Rand benefit to 11,000 for next year. Our breast cancer reconstruction benefit has had a nice increase as well from 25,000 Rand to 27,000 Rand per lifetime claim for 2024. Our MRI CT scan cover has also had an increase up to 7,000 Rand for next year. And our trauma care cover benefit has also had a slight increase for 2024 to R2,500. For our in and out of hospital benefits, you'll see that we've added a new benefit, which is our screening cover for scopes. This is for investigative purposes. It's a new benefit that we've added, and it's limited to one claim per insured for every 5 years, maxed at R7,500 per claim. Co-payment cover for scopes has had an increase as well. Our sub-limit for MRI, CT and scan cover has also increased from 38,000 to 41,000 for next year. And then two nice benefits which we've had, and we've seen a fair amount of utilization on them, is our casualty benefits for illnesses and our casualty benefits for accidents. So both of those benefits have had nice increases going into 2024. Our first diagnosis of cancer benefit, we've had some nice increases over there on stage 3 and stage 4. On stage 3, we've increased that to R25,000 per payout, and on stage 4 to R30,000 per payout. Our personal accident benefit, we've also increased to R32,000. Critical illness benefit, we've increased to R12,500. Our medical scheme contribution waiver, we've also increased to R6,600 for next year. On the dental benefit side, our sub-limit for impacted wisdom, teeth, orthodontic and accidents and oral cancer, we've increased to R32,500. Our sub-limit and co-payment for dental implants, we've increased to R54,000. And the new benefit that we introduced at the beginning of this year, which was a basic dental cover for children, we've also had an increase on that to R4,500 per family per annum for children under the age of 12 years old. Moving on to our optimal option. Our optimal option has also had a significant growth over the last year, and has also had some nice benefit increases for 2024. The premium on the optimal option has gone to R445 for under 65s and R643 for over 65s. There is no individual rate on the optimal option for 2024. Our sub-limit benefit cover has increased to R31,000. Our non-DSP benefit, we've increased to R12,500. Once again, the overall annual limit has increased in line with the demarcation regulations, and obviously we're subject to change in April next year once again. With regards to the in and out of hospital benefits, there's been some nice increases in these benefits going into 2024. You'll see we've also introduced the screening cover for investigative purposes. We've added a benefit on there, capped at R6,000 and one claim per insured for every 5 years. Our innovative cancer drug benefit, as the same as the premier option, we've also had an increase on that of up to R11,000. Our breast cancer reconstruction benefit, we've increased to R20,000. Our MRI CT scan cover, we've increased that to R6,000. Our trauma care cover benefit has an increase. A co-payment for scopes, we've had an increase. The sub-limit for MRI and CT scan cover, we've increased that to R31,000. Once again, the casualty benefits for both accidents and illnesses, where we have seen a fair amount of utilization, we've increased those benefits quite nicely as well. The personal accident cover, we've also had a nice increase there of up to R18,000, and that's obviously per person on the policy. Our critical illness benefit, we've increased to R8,500. And once again, same as the premier option, our medical scheme contribution waiver, we've increased that as well to R6,600. Then on the dental benefit side, you've got the benefit for your sub-limit benefit for impacted wisdom, teeth, orthodontic accidents and oral cancer. We've increased that to R22,000. Our sub-limit and co-payment for dental implants, we've increased that to R22,000. And once again, the basic dental cover for children under 12 years old has had an increase to R3,500. Moving on to the synergy option. The synergy option has had a premium increase to R380 for under 65s and R532 for over 65s. Once again, the overall annual limits increased in line with the demarcation regulations. The co-payment benefits are subject to the overall annual limit. The sub-limit benefit on Synergy has had an increase to R31,000. The non-DSP benefit as well has had an increase to R9,700 for next year. The MRI CT scan cover, we've increased that benefit to R5,000, and our trauma care cover benefit once again has increased as well to R2,500. Your co-payments for scopes has had a nice increase to R5,000, as well as your sub-limits for MRI, CT and PT scan, we've increased that benefit to 31,000. Your casualty benefits for accidents and illnesses have also had nice increases. Accidents to 10,000 Rand and casualty benefit for illnesses to 3,500 Rand. Your personal accident benefit has had an increase to 12,000 Rand, and once again, as the same as the other options, your medical scheme contribution waiver has had a benefit increase to 6,500 Rand. When it comes to your dental benefits on the synergy option, you'll see your sublimit for impacted wisdom teeth, orthodontic accidents and oral cancers had an increase to 22,000 Rand. Your sublimits for co-payments for dental implants as a result of an accident and or oral cancer has had an increase to 22,000 Rand. And once again, your basic dental cover for children under 12 has an increase to 2,500. Moving on to the MedExtend option. The MedExtend option for 2024 premium is 386 for under 65s and 525 for over 65s. The overall annual limit once again increased in line with demarcation regulations. There's a casualty benefit for accidents and illnesses on the MedExtend option, which we introduced at the beginning of this year. We've increased that to 4,000 Rand. Your MRI and CT scan cover, where there's no benefit available in your medical aid, we've increased that to 5,000 Rand for next year. Your co-payment cover, once again, we've increased that to 6,000, and your medical scheme contribution waiver is increased to 6,600. When it comes to the defined benefit list on your MedExtend option, you know, there's obviously a whole host of benefits over there, from arthroscopic surgery to joint replacements. All of those benefits have had some really, really nice increases. And just to give you one or two examples, joint replacement has gone from 56,000 Rand to 60,000 Rand, and endoscopic procedures has gone from 7,000 to 7,500 Rand. And then once again, you've got your claim-free period over there that will add an additional value to those benefits depending on the length of period that the member hasn't claimed. Okay. Our launch option, we had a premium increase there to 164 Rand for under 65s and 285 for over 65s. We obviously the overall annual limit once again. We've also introduced a new benefit on the launch option, which is your co-payment cover, where there's a benefit now for next year of 3,500 Rand and it's limited to one claim per family per annum. The casualty benefit on the launch option is increased to 6,500 Rand, and the medical scheme contribution waiver, as per the other options, is increased to 6,600 for 2024. Moving on to travel cover. The travel cover has obviously been a really nice value add on the Turnberry product range, and we've had some really nice changes and increases on the benefits for this going into 2024. One of the benefit increases is the dental benefit increase. The dental benefit, we've increased that from 5,000 to 10,000 Rand on the standard option. So it's not part of the top-up anymore, but it's part of the standard option, and it's had a really nice increase on that. With regards to the other benefits on the top-up side of the travel cover, so if a client is interested in taking out additional cover when traveling, there's a whole host of benefits that they receive. And those benefits, obviously, you can see, and there have been significant increases on them as well. One of the new benefits that we have added onto the travel cover for 2024 is your car rental excess waiver of 5,000 Rand. So a really nice new added benefit onto that. And then obviously, as mentioned, all the other benefits have had some nice increases. The top-up rates have had a slight premium increase as well. For example, you've got the premium from 2023 of 525 Rand, it's gone to 565, and 730 Rand to 780. Okay, our group quotes. We've had a really, really successful year in terms of group quotes and the offerings that we've provided. We've had a really good uptake in terms of new business on the group side. There's obviously certain information that we require when it comes to offering group quotes, and the more information you can provide us, the better we can obviously come out with a really good rate. The demographics we're looking for is obviously the average age of the group, the medical aid option that they're on, the dependency ratio, and if possible, if there is a claims profile on the group, if you could provide it, we can really come out and provide you guys with some really good rates on the various options that we have available. With regards to underwriting, I think you guys will know during the course of this year that we've ran some really nice concessions from an underwriting perspective, where we've only gone and imposed waiting periods on certain conditions. For example, there would be a 12-month on musculoskeletal, there would be a 12-month on cancer, and a 12-month on gastrointestinal, and then a 10-month on pregnancy. All the other conditions, we waived the underwriting, as well as the 3-month general waiting period, that we've waived as well. So we've run these concessions throughout the year. They've been very successful. And as it currently stands, we're running the same concession up until the end of December, where I'm pretty sure at the end of the year, Brian, Tony, and myself will have a chat, and we will look at whether we're going to run it for an extended period going into next year. Then our broker training and CPD platform. It is available on our website, and I encourage you guys to please go on to have a look at it. It's got a whole host of benefits on there, starting off with the various articles that if you go on and you read, there's a quiz that you would have to take afterwards, and you can get the necessary CPD points. We have all our brochures and application forms on there. We have the product-specific training presentation on there that you guys can go on and you can have a look at. We've got various social media articles that we've done over the year, and we encourage you to go on and have a look at, and then obviously you can share that with your clients as well. We have some nice client testimonials and broker testimonials on there. And then obviously important, we also have the launch presentation on there, so you can always go back and have a look at it if there's something that you've missed. We then have our Turnberry digital application form. Cheryl and her team have done a lot of work on this over the last couple of years, and we really do encourage you to go on and have a look at it and to make use of it. Obviously nowadays, people are not necessarily in the same geographical location anymore. You might be having meetings with your clients on Teams or Zoom. Your client can then go onto it, complete the digital application form. There's no specific software that they need to downgrade in order to sign it. They can sign it, submit it, and it comes through and is loaded onto the system. The other upside of the digital application form is from a group take-on perspective. For larger groups that you might not always have access to, the members can go on, they can go and complete the digital application form online and then submit it through to Turnberry, and it will be captured accordingly, and obviously notification will be sent to both yourselves and to your clients. And then last but not least is obviously all the nice things about premium increases and benefit increases and new benefits on the different products. But at the end of the day, obviously when a client submits a claim, you want to know that it works. The clients can submit the claims via a normal claim application form, but we also have the online application that clients can use. Client goes on, they complete all the information, they attach the necessary documentation that needs to go with it, and they can submit it. Provided all the necessary documentation is there, and I'm talking about copies of the medical aid statement, the hospital account, or the doctor's account. Okay, if the client submits everything over there, claims really does work. And I know Brian spoke about it a bit earlier. We normally work on about a 7 working day turnaround from time of submission to time of claim payout. But I know we go through phases where these are done or claims are paid within 2-3 working days. If everything is there, guys, the claims really do work. Guys, and I think with that, I really would like to thank you for your time and for your patience today. I'm going to hand over now to Andre Jacobs. I'm sure a lot of you will know Andre. He's been in the industry for many years. Andre he works for the People Company, and he's the vice chair of the FI Health Exco. And Andre is really just going to chat to you guys today a little bit about NHI and the developments with it. Guys, with that, once again, thank you very much for attending.
Where are we going with NHI? So good morning. It is such an honor to share some thoughts with you on NHI today. But firstly, I want to inform you that I will be nominating prizes for this event. These spot prizes will go to 25 brokers who attend the launch today, and post the launch we will inform you of the final winners. Please note that my presentation will also be qualifying you for CPD points, and the CPD certificate will be provided you after you've done an assessment and passed the assessment. Details to follow post the launch. So our agenda consists of 6 parts, but that will be dealt with briefly. So let's go on to the first topic, which is the healthcare systems that operate globally. This section deals with 4 main healthcare systems that exist globally. The beverage model fund healthcare provision directly from income tax deductions, and most hospitals are owned or operated by government. Most healthcare staff include doctors and nurses that are employed by the state. So the UK National Health Service operates this model. One of the main advantages of the Beveridge model is that healthcare services are free at point of service to every citizen. The government is responsible for funding all health services upfront with the money raised from tax deductions, and the healthcare systems that operate the Beveridge model are frequently beset by long waiting lists for treatment. The Bismarck model operates differently. It is known as a social health insurance system, where the healthcare system, which people pay to fund, that in turn pays for the healthcare activities that can be provided by the state-owned institutions, other government-owned institutions, or private institutions. Countries such as Germany, France, and Switzerland have adopted the Bismarck healthcare system. The Bismarck healthcare system usually has significantly higher accessibility to lower waiting times, thanks to the competition between the consumer-oriented healthcare system. National health insurance, on the other side, uses elements of the Beveridge model and the Bismarck model. And countries like Canada, South Korea have operated the NHI model. In this system, government is a single payer for all healthcare services like the Beveridge model, but under the NHI model, funds are raised through state-operated insurance schemes that every citizen pays into. And most healthcare service providers are privately owned companies, as in the case of the Bismarck model. This system can also lead to long waiting queues. According to Canada's Fraser Institute think tank, the median wait time for medically necessary treatment in Canada was 20.9 weeks in 2019, and in some regions it can actually increase to almost a year. The last model that I want to touch on is the out-of-pocket model. This model is a method of accessing healthcare that is most common in developing countries where no formal statewide system exists. People in rural areas of India and China, as well as parts of Africa and South America, use healthcare in this specific way. Health services are not always available, and even when they are beyond the financial means of the people. So we need something different. Universal health coverage means that all people have access to a full range of quality healthcare services when they need it and where they need them without financial hardship. It covers the full continuum of essential health services, from health promotion to health prevention, treatment, rehabilitation, and palliative care. And that is what we strive for in South Africa. So when we look at the healthcare system of Canada, it is a publicly funded NHI system known as Medicare. The system provides universal coverage for medical necessary hospital and physician services. Each province or territory administers its own health insurance plan, and the funding comes from taxes and government transfers. On the other side, Germany has a dual system consisting of both statutory health insurance and private health insurance. Statutory health insurance covers most of the population and is compulsory for employees below a certain income threshold. Contributions to the system are shared by employers and employees based on income. Private health insurance is available for higher income individuals and offers additional flexible benefits and flexibility. Australia's NHI system is called Medicare. It provides universal coverage for essential medical services and is funded through a combination of taxes and a levy on high-income earners. Medicare can be supplemented by private health insurance for additional coverage, such as private hospital care or extras like dental or optical services. Japan has a mandatory social health insurance system. It covers all residents and is funded through premiums based on income. The system is decentralized with multiple competing insurance funds. The government sets fee schedules for medical services, ensuring affordability and access to care. This section focuses on the reason government provides why NHI is appropriate for South Africa. So government wants us to believe that NHI is about Ubuntu. We take care of each other as a nation in times of need. NHI is the South African way of providing access to high quality healthcare for everyone. And government says that national health insurance is a way of providing good healthcare for all by sharing the money available for healthcare among all the people. The health benefits that you receive will depend on how sick you are and not on how wealthy you are. If we can feel and act in unity about football and rugby, surely we can do the same when it comes to matters of life and death, health and illness. None of us would like a fellow human being to die, become disabled or live in pain just because he or she could not get decent health care. That is what government wants us to believe. So how will NHI actually work? So under the NHI, you will still have access to your preferred clinic or hospital. If you seek treatment in that facility that is not registered with the NHI, or if you wish not to follow the referral pathway, your expenditure may not be reimbursed. This will necessitate you to pay then cash out of your pocket for the services rendered by that particular facility. When you see a nurse or a GP, they will attend to you and decide if you need a specialist. You will then be able to get a level of care that you will need according to the criteria that they have set for you. So the question in the mind of every intermediary and member of a medical scheme is, how will medical schemes work and what will their role be? And medical schemes will still exist, but will not be able to fund cover that is the same as what the NHI will provide. And we will ask a question, what will it cost? Now, what the government says is that NHI will combine the many public and private healthcare funds into one fund that will pay for everyone when they need access to healthcare, using the advantage of size of the fund to reduce the healthcare costs. Initially, there will be no tax for the NHI. Government will pool the funds that already exist in the public sector to start the NHI. When the NHI is up and running, the Treasury may introduce a small tax to augment the money or allocate it through the public budget, according to what government says in the brochures about NHI. So now, that's what government said, but if we now go and look at what the bill actually says, there was 132 amendments made by the Portfolio Committee on Health to the original NHI bill. After 380,000 written submissions were received, 9 hearings in 33 provinces, 11,500 members attended, and 961 oral submissions made. 114 stakeholders made oral presentations to the Portfolio Committee on Health. The Portfolio Committee on Health received legal opinions from the state law advisors, as well as the parliamentary law advisors and the Freedom Front Plus. So the Act defines a health product. But what I want to convey to you in this slide is a non-legal definition of what a health product is. And you can see that a health product includes a comprehensive set of benefits, such as essential services to maintain your health, to prevent serious health problems, primary healthcare, emergency healthcare, diagnosis, treatment, rehabilitation, and a range of other services, including palliative services. Now, when we take that definition and we read that definition with Section 2A of the National Health Insurance Bill, it states that the purpose of the Act is to establish and maintain a National Health Insurance Fund in the Republic funded through mandatory prepayment that aims to achieve sustainable and affordable universal access to quality healthcare services by serving as a single purchaser and single payer of healthcare services in order to ensure the equitable and fair distribution and the use of healthcare services. This means that you cannot purchase healthcare services. Remember the comprehensive definition of the health product from any other entity than the state. So who will be covered by the NHI bill? It is citizens, permanent residents, refugees, inmates, and then children. that will receive certain basic healthcare services. Asylum seekers, illegal foreigners, and certain categories of foreigners will receive limited cover under the NHI. This is quite an interesting slide where we talk about you need to register your beneficiary on the NHI system. So parents can have the duty to register their children, but children can also, between the ages of 12 and 18, register themselves. But you have to provide certain biometric information. Fingerprints, photos, proof of residence, your identity document, original birth certificate, which may prove to be an administrative challenge, as I don't know where my original birth certificate is. And I have to also provide my refugee ID card, which I am not a refugee in South Africa, but the bill is written that I must provide that document. It's not an or a choice that is given, it is a compulsory document that I have to submit. So what are my rights under the NHI? And you will have the following rights: to receive quality healthcare at point of service, to receive information regarding your benefits, to access the records regarding your own health, and not to be unreasonably denied healthcare services, not to be unfairly discriminated against, and not to be subjected to unreasonable delay. And remember what I said about single-payer systems in Canada, where the delays are sometimes longer than a year. Our law says you would not have that in South Africa. And to receive a professional standard of care, and to make reasonable decisions regarding your health care. And then under the NHI, you also will have the right to lodge complaints and appeals. You can also request written decisions or reasons for the decisions that was taken. But you don't have the right to receive an answer on that request. You can request it, but you don't have a right to receive an answer. It would have been helpful if we had a clause to say you will receive an answer within 30 days or 20 days. But if you need emergency care and you request a reason why you can't get it, a delay in an answer or not giving an answer at all will not help you with your rights. So when people ask what will be covered under NHI, this specific section deals with it, and it says that the Benefits Advisory Committee will determine healthcare services that beneficiaries will be entitled to. And then they go on and they say when certain services are not available, what you will have. If this specific section 7 is unclear to you, you are correct. It is as clear as mud. So what will not be covered under NHI? And again, what is not covered is again still unclear. But they say that if no medical necessity exists, if no cost-effective intervention exists, or if the product and treatment is not included in the formulary. Look at the words. The treatment is not included in the formulary. A formulary is not treatment itself. We call that a protocol. So where will government get the money to fund NHI? And I initially said that there will be no tax for NHI, but the bill seems to have a different implication. The NHI will be funded from general taxes, reallocation of tax credits, and the payroll tax on employee and employer. So what government says in the marketing material about NHI is factually not what stands in the NHI bill. The Minister of Health also have the power to regulate certain aspects. And the first one is the legal relationship between the fund and various healthcare establishments and service providers and suppliers. The legal relationship is established by certain law, such as the Companies Act, the law of contract, the law of obligations. Therefore, it is totally improper to bestow this power onto the Minister of Health, and is a total overreach of his powers. There's various other aspects that the minister can regulate, like the budgeting process, the clinical or diagnostic codes. Again, there's a confusion in the wording with protocols and formularies, and in participation in the HI healthcare information system. The Minister also has certain powers to issue regulation about the registration of users, the accreditation process and procedures, and functions and powers of district health management officers. The Minister again have power to develop and maintain the formulary. Again, no reference to the protocol. Suppliers of the NHI fund, the reporting processes and types of reporting of healthcare establishments and providers to the fund. And again, the relationship. Here they take out the legal relationship, but just the relationship between the public and private health establishments. The Minister of Health also has the powers to regulate the following: maintain the performance of the fund, fees payable to the fund, but this conflicts with Section 49, as Parliament actually allocates funds to the NHI fund. How money must be invested. So when regulations are made, usually the public can participate. Now the Minister must provide 3 months notice if the Minister intends to make changes to regulations, unless the Minister thinks that it is in public interest not to follow the public participation process. This can have serious consequences to undermining the principle of participative democracy and consumer rights. We saw that in the COVID situation where we couldn't wear short pants, and that was a regulation made. Minister can do that in terms of the NHI bill. The NHI bill is poorly drafted and contain many uncertainties, conflicting clauses and irrational clauses, and clauses that impact the constitutional right of citizens. There is a high likelihood that a bill, if enacted, will be challenged in the Constitutional Court. This section deals with some of the possible constitutional challenges that we can expect. The NHI bill is a money bill and is known as a framework legislation. Framework legislation has certain challenges. It creates a certainty vacuum until subordinate legislation is enacted. By its nature, it defers the legislative process and can potentially allow too much subordinate legislation with limited parliamentary oversight. This may lead to inappropriate discretionary power in the hands of the Minister. Our Constitution is framed on the principle of participatory democracy, but subordinate legislation may reduce this. This may lead to constitutional challenges. There are some general principles of legality that legislation must adhere to. The law must be clear, certain, rational, and accessible. The exercise of public power must be within the bounds of the law and consistent with the Constitution. When this matter is referred to the Constitutional Court, the Constitutional Court will most likely consider the following to decide if the National Health Insurance Bill meets its constitutional muster. First of all, they will do a textual interpretation, so they will look at the words that is used. Are the words consistent with the Constitution and specifically the Bill of Rights? Their consistency between sections, or does the one section contradict the other section? Does the proposed bill contradict any other established law, like the law of contract? Are the discretionary powers of the ministers appropriate? Are there any limitations of rights contained in the Bill of Rights justifiable? And then the court will look at the purpose of interpretation. So what is the purpose behind the bill, and is that achieved? The last aspect the court would look at is the reasonableness. And is the bill itself reasonable? It would be reasonable if the bill doesn't diminish or detract from existing rights. Does the bill create new rights? And is that rights that is created justifiable? Does the bill promote progressive access to equality healthcare and prevent unfair discrimination? Does the bill promote right to fair and administrative action? When the court looks at rationality, accountability, responsiveness, openness, limitation of rights, the considerations can be whether the bill as a framework creates too much uncertainty, such as uncertain about the benefits. Can the bill be rational if the framework is not clear on the level of benefits? Can the bill be rational if the role of stakeholders are not clear, such as private healthcare sector and medical schemes? And can the bill be rational if it is unclear how the money bill will be funded or how much funding is required for the bill. The bill also confuses healthcare delivery and healthcare funding, and is this rational? I would submit not. Framework legislation can only be rational if the minister's powers is defined and boundaries are set for subordinate legislation. Sadly, this didn't happen. This section deals with what happens if the bill is not passed or if the bill is struck as being unconstitutional. And when this happens, it will mean that we will have the status quo, that the public healthcare service will further deteriorate, that the private sector will become more expensive, our GAP products will become more expensive, and all citizens in the country will suffer, with the emphasis on all citizens in the country will suffer. So is there an alternative? This last section focuses on a constructive proposal that FIA made in terms of the NHI bill. And this is what we represented to the Portfolio Committee on Health, and that we will also present to National Select Committee on Health in the National Council of Provinces. This proposed transformed healthcare system comprises of the following. Firstly, it focuses on prevention as key focus. All citizens should have access to ward-based primary care and the integrated school health program and emergency care, whether it is rendered in the public sector or in the private sector. And these services may not be provided by medical schemes and are funded from general tax. A set of minimum benefits should exist in the public sector and in the private sector. This will include referral pathways, starting with nurses, then GPs, and then specialists. The integrated clinic will provide specific primary care diagnosis, care and treatment of chronic conditions, and hospitals will be included. These services will be funded from general taxes. As I said, the same benefits will also exist in the private sector. The same formularies, the same referral pathways, the same protocols. And these benefits in the private sector will then come from the medical scheme contributions, and a risk equalization fund should also then be established. Contributions in the private sector must still be based on community rating and open enrollment. The private sector can then also provide supplementary benefits that can additionally be covered by health insurance products or additional higher benefits that you purchase on your medical scheme. Again, that must be community rated and subject to open enrollment. In the public sector, the members will then be able to have access to an ex gratia funding. Mandatory membership must be implemented for people over a certain income threshold that will have to make a compulsory contribution to medical cover. However, these people can opt out of the public service into the private sector, and a portion of their contribution will then be rebated to them, but a portion will be kept in the public service as a social solidarity contribution. Taxpayers should be incentivized for healthy lifestyles and penalized for poor health lifestyles. The formula and criteria should be simple, but should drive the correct behavior. The same should be applied to companies, where they should be allowed a tax reduction for improving the health of the employees and the community around the employer. Which brings me to the clinics. Employer-based clinics must be allowed to form part of the healthcare system, where services can be rendered to the community surrounding the employer. And employers rendering these services must be able to claim for the services rendered to the community and or receive a tax rebate or incentive for rendering the services. Public and private partnerships must be established in terms of academic hospitals, nursing and training facilities to ensure that we have the correct production of health personnel. A controversial suggestion is maybe the delayed prepayment. Healthcare is not free. Someone must pay. While social solidarity will reduce or require the unemployed not to pay for healthcare services, an appreciation of the cost of healthcare needs to be instilled. When the unemployed are employed, they need to repay a portion of the free services that they received. The concept is modeled on the free assist model of the Australian education system. We believe that this supports also the International Labour Organization's observation that healthcare is not a free service. And when people understand the cost of healthcare, the quality improves. Thank you for this opportunity that I have today to talk to the people about NHI and to understand what the impact is. In the meantime, what do we do as brokers in the meantime? In the meantime, we need to keep on guiding, educating, and protecting our clients to ensure that their healthcare needs are taken care of. Thank you.
A big thank you to Andre for his overview on NHI. I hope and trust that it's given you some interesting insights into where we are and a possible view on the plan ahead. There will be some CPD points available and details of that will follow. But more importantly, thank you again for your business. We really appreciate it. And thank you for giving some time to us today to just give you an overview of the business and where we are and our product range for 2024. Thank you, and cheers, guys.